In a bold and controversial move, President Donald Trump has officially withdrawn the United States from the World Health Organization, a decision that has sparked widespread debate across the globe. Trump's announcement comes after years of mounting criticism against the WHO, particularly for its handling of global health crises such as the COVID-19 pandemic. According to Trump, the WHO has repeatedly failed to demonstrate accountability, fairness, and effectiveness in addressing global health challenges. He claims the organization is unduly influenced by certain nations, most notably China, which he argues has compromised its ability to act in the best interests of the international community. The United States has been the largest financial backer of the WHO, contributing approximately 18% of its total budget. Critics of the organization, including Trump, argue that this level of funding is disproportionate and places an undue burden on American taxpayers. Trump has long contended that the WHO has become increasingly politicized, serving the interests of specific member states rather than functioning as a neutral arbiter of global health policy. This move, he asserts, will redirect U.S. resources toward more effective and transparent avenues for improving global health, prioritizing initiatives that directly benefit American interests. Proponents of the withdrawal emphasize that the decision reflects a broader strategy of putting America first. By stepping away from the WHO, the U.S. can focus on bilateral and multilateral partnerships that align more closely with its own values and objectives. For example, the Trump administration has pledged to redirect funding toward domestic public health programs and partnerships with allied nations, potentially creating a more targeted and efficient approach to combating global health threats. Advocates argue that this decision will empower the U.S. to take control of its health initiatives without being tied to an organization they view as inefficient and overly bureaucratic. However, the withdrawal has not been without controversy. Critics warn of significant repercussions for global health initiatives, particularly those addressing diseases such as malaria, tuberculosis, and HIV/AIDS. These programs often rely heavily on U.S. funding, and the absence of American contributions could lead to severe disruptions in their operations. Moreover, skeptics argue that the U.S. risks isolating itself from vital international networks that share data and resources critical for responding to pandemics and other health emergencies. Without the WHO's infrastructure, the U.S. may face challenges in coordinating responses to transnational health threats, potentially putting its own population at risk. International reactions to the withdrawal have been mixed. Some countries have expressed concern, viewing the move as a retreat from global leadership at a time when coordinated health responses are more necessary than ever. WHO Director General Tedros Adhanom Ghebreyesus has urged the U.S. to reconsider, emphasizing the importance of unity and collaboration in addressing health challenges that transcend national borders. Meanwhile, nations such as China and Russia have seized upon the opportunity to expand their influence within the WHO, further fueling the debate over whether the U.S. withdrawal will lead to a power vacuum in global health governance. Domestically, the decision has sparked intense discussion about the role of international organizations in U.S. foreign policy. Supporters argue that the move is a long overdue assertion of American sovereignty, demonstrating that the U.S. will no longer subsidize organizations they believe fail to serve its interests. They highlight that the WHO's perceived mishandling of the COVID-19 pandemic, ranging from alleged delays in declaring a global health emergency to accusations of being overly deferential to China, underscores the need for reform and accountability. On the other hand, opponents of the withdrawal argue that disengagement from the WHO sends the wrong message at a critical time. They believe it undermines America's credibility as a global leader and risks weakening its influence in shaping international health policies. Critics also point out that the decision could have unintended consequences, such as emboldening adversaries who may seek to dominate the organization and reshape its priorities in ways that could disadvantage the U.S. and its allies. The financial implications of this move are also significant. By withdrawing from the WHO, the U.S. forfeits its ability to influence how its contributions are spent. Supporters of the withdrawal argue that this funding can now be redirected toward more effective initiatives, ensuring that American tax dollars are used to achieve tangible results. For instance, the administration has proposed increasing investments in domestic health programs, such as the Centers for Disease Control and Prevention, CDC, as well as fostering partnerships with private organizations that prioritize transparency and outcomes. Despite the polarizing nature of the decision, one thing is clear: the U.S. withdrawal from the WHO marks a turning point in global health diplomacy. It signals a shift away from multilateralism and toward a more unilateral approach to addressing international challenges. Whether this strategy proves to be a bold assertion of American leadership or a risky gamble with far-reaching consequences remains to be seen. What is certain, however, is that this decision will have lasting implications for the future of global health and America's role on the world stage. For Trump and his supporters, it is a necessary step to prioritize American interests and hold international organizations accountable. For his critics, it is a dangerous retreat from a shared responsibility to tackle the most pressing health issues of our time. Only time will tell how this decision shapes the global health landscape and the United States' standing in the years to come.